Good morning and welcome to Digital Health Days 2015. It's our second day of this inspiring and communicative and creative event. And today we are starting a bit later at 9 o'clock instead of 8:30. So we say welcome to all of our web viewers all across the world. So happy to have you with us. This also gives us an opportunity to talk to our commentators who are positioned here in what we call the cage.
Yes, welcome to the cage.
Welcome to the octagon, right?
And I also have, of course, Donnie. Donnie's also joining me here, so we thought we would have a bit of a chit-chat with you guys.
Yeah, absolutely. Yesterday was amazing. I loved it as a researcher and as a writer for the Humans for Digital Health blog. It was fantastic to see it all come together and see such relevant topics talked about. One topic that I think is fantastic, which I want to talk with Bastian, our social media manager. What happened on Twitter yesterday?
Yeah, it was crazy what happened on social media yesterday. We sent out about 550 tweets concerning the Digital Health Days. Pretty much about all the topics that were discussed yesterday, from diabetes to Parkinson's disease, from multiple sclerosis to pretty much every topic that was covered yesterday in the different presentations. We had an amazing day going on Twitter yesterday. We had 36,000 people that saw our tweets.
And that's globally.
And that's globally, yeah.
Wow.
Pretty much in all the English-speaking countries, and we are speaking to people in 8 different languages, including Arabic at this moment. So we're reaching out, actually. We're trying to connect people to each other, connecting organizations with each other, and we were trending topic yesterday. All day long, we were #1 in Stockholm. We were between #3 and #5 in Sweden. We also were trending topic in Europe as well. So we did quite well on social media. And the Digital Health Day hashtag DHD15 was used all over the world. So it was an amazing day, yeah. Yeah, exactly.
And how can people here help today? Because we wanted, yesterday was yesterday, today is today,
Yeah.
right?
Yeah, well, of course, everyone can join the conversation using the hashtag DHD15, which is our way of getting in touch with everyone. And whatever happens on the conference, if you have a burning question or you want to ventilate your opinion about a subject that has been discussed on stage, just add that on Twitter. We will be retweeting every question so that it gets connected to the organizations and to the people that have been talking on stage. So for us, it's more, the social media is more meant for connecting people. So people can put their questions out there and get opinions from other people.
I think that's important to stress as well. It's not just a commentary,
No.
it's actually a dialogue.
No.
So if people do have questions, and not only people here attending the event, but also people watching the live stream,
Exactly.
Yeah.
please interact with us.
Yeah.
We are here today, and questions, comments, anything, just get the dialogue going.
Yeah.
It's like we said yesterday, this is a co-creation between, the organizers of DHD and you web viewers and also the attendees here, because you're a dynamic mix and we want all your feedback and opinions.
Exactly.
And
I
digital reach.
Yeah, I think the social media channel is growing in popularity as well because, well, we are a social media area. So I think when someone is having a doubt whether they have to ask their question on stage or whether they have to ask their question on Twitter, just ask it. It's not a problem. Just add the DHD15 hashtag to it, and we will bring that question to the person that is responsible or can give you the answer to it. And also, it's also worth mentioning that we have a YouTube channel as well, and that is constantly being mentioned on the Twitter feed as well. So
There's always a recap, so if someone's missed a speech or a keynote speech.
every interview that is being held is being published to YouTube. So if you want to review an interview, if you want to listen again or get in touch with that person that has been interviewed, just follow our YouTube channel or our Twitter feed, and we will get you in touch with them.
Perfect. And also to mention the Mina and Dina show, which I'm sure all of you web viewers are familiar with, that they always have interviews as well. They're up on YouTube, and they'll be here between 12 and 1. And we have another panel commentator member.
Yes, and I think the speech we heard yesterday from Tara, it ties perfectly to what Bastian says. And Tara's organization wouldn't exist if it weren't for social media. So she supports 41 countries all over the world with information regarding HS. And she had a lot of questions yesterday through her channels as well. So for the patient environment, we're not tied to countries anymore, and that is thanks to social media. So they have an enormous outreach, and she was so thankful for being here yesterday and being able to share information about her association and about the disease. So I think it ties perfectly together.
And she was also the perfect example that some of the speakers were talking about, that we really need to have the patient's perspective and the patient's insight. And Tara is, was or is still a patient, but also actually used digital innovation to do something about it.
Yeah, and I think most of us, as we heard yesterday, we are patients in one sense or another. I'm a patient. I've lived with chronic disease for 20 years. So when we search for information, we do it through the internet. And even if I'm in Sweden, I might not find my information in Sweden. I can find it in Russia or Africa or whatever. So, and she has a drive, a real drive for sharing this information, and that's her channel, the most valuable channel, I think. And it's about connecting, even though it might be entrepreneurs and startups or patients.
And Donny, what about you? You were with me there upstage, and you met many of the keynote speakers.
Of course, I enjoyed the content, but it's a bit like some other conferences that I've been to, where you feel that really good talks, but fantastic coffee breaks. Mm-hmm. No, but seriously, it's and the interaction and the dialogue, and I really enjoyed that we had the cage, the panel. The discussions we got, because we did get good questions and we did get good dialogue going yesterday. I appreciated it, and I like dynamics. I like dynamic discussions and dialogues. And if somebody's on stage and they say something, and then everybody else goes, "Yeah, that was great," then okay, that's nice, but it doesn't really sort of, So I enjoy the back and forth and the questions, and even if it's if you have an opposing opinion, it doesn't mean that you're sort of. It just adds to the dialogue. That's how we learn.
Exactly.
So I appreciate the whole package of getting everything together and people talking to each other. I'm looking forward today to the Q&As as well. That's the...
Yeah, definitely. And
I'm taking it as a challenge.
And of course, we can also highlight if we get any relevant questions on Twitter with regards to any keynote speakers. Of course, we can highlight that.
Yeah, definitely. I will be monitoring the Twitter feed as well, also when I'm sitting in here. So whenever someone has the burning question, just post it to our Twitter feed, and we will make sure that it's going to be asked as well. So I cannot stress enough on it. Just use the DHD 15.
We want to go towards 50,000.
Exactly. Well, we're going to reach that today. I'm sure about that.
Great. Well, thank you for the effort. So just briefly, what are your expectations of today? Any speakers, any topics, any sort of... What are your hopes, maybe?
I hope that I hope, like Donny said, that we ask some really good questions, and I hope that we challenge them a bit today. I also hope that we give a look at the digital health world in a very realistic way. There's a lot of things to go, and that's what's exciting. There's a lot of things that we need to do, a lot of things that we can do, which is what's exciting. So I hope that we just have a really burning question of not presenting something in a good way, but presenting something with the opportunity that's there.
In a doable way.
Yes.
Walk the talk.
Yeah.
Great.
Yeah, I think for me it's the same thing actually. I'm looking forward to today. Especially I have a lot of questions because I'm not only a developer in the healthcare world, but I'm also a user of the healthcare system. And what I see as a 27-year chronic patient is that I see a lot of fragmentation in the market, and especially when you look at yesterday's presentations, I just keep on wondering how people are going to tackle this fragmentation in development, because we're very enthusiastic, we're very much working on solutions, but we're not connecting them in a proper way yet. What I'm afraid of as a patient myself is that people are getting tired of all these solutions because they want to have one solution that works for everything and not 1,000 different solutions that is being changed and published today. So that is my hope for today, and especially also as a social media manager, I hope that today not only professionals at the conference, but also patients as well, are going to raise their voice and ask their questions. So
that was a very good initiative.
Yeah.
Raise your voice and ask the questions. because that's how we get answers.
I actually know that one of our first keynote speakers, Juliana, is going to touch on that subject when it comes to the silos of today's digital health.
I will have some very good questions. then
Yeah,
for her.
so you know, no pressure, Juliana.
Okay. Well, it's going to be an exciting day, so let's get it started.
Yeah.
Let's get going.
Yeah, absolutely. Enjoy.